While some have been with us over the past few years and some have joined us later, most or everyone here knows what we do, how we do it, and why do we do it. And without the exceptional collaboration with the Ministry of Health, we will not be able to have achieved what we achieved for the past 40 years. For this, I would like to invite Honorable Minister to give us few remarks on this special occasion. You're very welcome.
Shukran ya Wakil. Honorable Deputy Minister of Foreign Affairs, Honorable Technical Advisor, Procure remain observed in the mid of us, our partners, donors, ladies and gentlemen, Sabal Khair. It is with great pleasure that I'm here today to join you all in celebrating the 40 years of life-saving work done by MSF in South Sudan. As we have heard from my brother and from all the presentations that have been done, when I was present or not, MSF is providing humanitarian assistance through medical services, and they have been number one in what they do, and they're very good at it. Since its inception, as my brother mentioned earlier on, in 1983, in particular in Yei, and when it was established in Yei in 1983, was to respond to the millions or the hundreds of refugees flocking in from Uganda. And that was the time that South Sudan by itself was also having its own onset of the struggle. So it actually served both purposes, serving the refugees from Uganda and South Sudan people at that time when they were beginning their struggle. For 4 decades, MSF has worked tirelessly in most of the remote areas and challenging environment. The first trip that I had when I came to this position over a year ago, or close to 2 years ago, was with MSF. It was the trip to a Will Civil Hospital. And at that time, there was an outbreak, a meningitis outbreak in the area. There was measles outbreak in the area. And there was also a huge influx of people from the neighboring counties to a Will Center in regard to malaria. At that time, the health system was overwhelmed because we were also just responding to COVID-19. But the work that MSF did at that time was highly amazing. So my interaction with the MSF is not only when I'm in this position. It has been from also when I was in the refugee camp in Kakuma. It was also when we were transitioning from Sudan by then to Kakuma refugee camp when I was a child in Narus. So I still have got those vivid memories like of MSF trying to help the people of South Sudan. We cannot say enough thank you, but we will continue to work together. MSF has distinguished itself through its plurality, as my brother mentioned, and also you are super independent in what you do. We applaud you, and I would like everybody please to clap for them. This has allowed us to operate in the event in the most volatile and contested region together as a health sector. Because you come in to give life-saving, as most of us who work in the healthcare field, when you are graduating and taking your oath, you take an oath to serve everybody regardless that you're your enemy, that your friends, you like them, you dislike them. You take oath to do life-saving activities, and that's what MSF does. MSF commitment to this principle has earned respect and trust to all parties to conflict in South Sudan and around the world. You respond purely when you are needed, and that's highly commendable. MSF, as I mentioned earlier, want to respond to outbreaks like cholera, malaria. COVID-19 was the most profound one, and like an MSF did amazing. I know you are situated in you have 13 projects in 8 states and 2 administrative areas. MSF work in South Sudan has been truly transformative. It has provided medical services to millions of people, addressing a range of diseases, including malnutrition. Okay, welcome. Despite all this tireless effort, humanitarian need in South Sudan remain high. And I don't need to mention the reason why they are high, beginning with the climate change impact. South Sudan is at the aid recipient. South Sudan is at the receiving end of impact of climate change, of the carbon blueprint that are the nations that are actually producing more. We are at the receiving end of it. I just came from a climate change summit that was done in Nairobi, and then I went for a follow-up. You'll be surprised that the temperatures in South Sudan are 40% higher than the rest of Africa. And Africa is 52% higher than the rest of the world. Why? South Sudan almost produces nothing, but we are experiencing more and more. So that put us in the scope of needing more humanitarian assistance through various means like medical, food security, and all this kind of thing. The Ministry of Health is committed to working with MSF as well as other partners and donors in the country to address these challenges and improve the health of the people in South Sudan, regardless of where they come from. And I would like to underscore this, and I've said it in too many occasions and forums. For us to be effective as people working in the healthcare sector, we must coordinate, we must align, and we must be on the same page through frequent communication. My office is open, although I'm very busy, but we will try as very much as we can to realign. When realigned and we coordinate, and we must realign to the health sector strategic plan. That is the government guiding framework. You pick one portion out of it, realign yourself to it. That way we are not wasting the resources, we are not wasting our time, and we'll be hitting the SDG goals. For me, the one leading the health sector, I summarize it into 2 or 3: localization, resiliency, and sustainability. COVID-19 and so many outbreaks in South Sudan and let's say Africa and globe taught us that if we are not localized, if we cannot sustain our system, and our system is not resilient enough to absorb like the shock, we are always back to square one, and we are just putting out fires. So, and for us to avoid putting out fires throughout, like now when I came, I felt that I was leading 60 ministries of health in South Sudan, because each partner, almost each donor, almost each organization has got their own agenda that need to be implemented. And for us to keep up, to try and pull everybody on board was a little bit hard. But I'm very glad and happy to say that almost all our donors, almost all our partners in South Sudan are realigning behind the Ministry of Health. And I promise you that myself and my team, we will be committed fully to trying and making sure that our partnership is strengthened, to make sure that our partnership is transparent, and we have got accountability to one another. The Ministry of Health is engaging the top leadership and donor community in order to transform the health sector by promoting increased funding to retain staff. At the moment, we have got poor work retention package, both ways. And for those who are in the NGO world, it is a short-term contract that has got job insecurity. For us in the government sector, we are not putting in more resources, whereby people see the pastures on this side are greener. So there's always like going in between back and forth. That way, like our workforce retention package is very poor, and we are engaging different stakeholders to make sure that it is strengthened and is sustained. In addition, we are strengthening our partnership with international entities to promote ownership and sustainability for better and healthier population in South Sudan. As I mentioned earlier on, localization is very important. And MSF, you work with 90% of your staff, 90% of your entities that you work with are local South Sudanese, so that like the skills you have are directly transferred, and this will lead to the ownership. People in those areas own those projects. Just to conclude on this occasion, I would like to commend MSF. I would like to commend all our partners. I would like to commend all our donors and every single person who has come to this nation to contribute to bettering the lives of our people. Your work that you do is amazing, and sometimes words cannot express it, because for us to be able to continue to serve our population, it is because our partners and our donors are not only filling in the gap, but we are actually taking the lead. So we know it should be the other way around, but with the circumstances we have, with the instability, with the economic issues, with transitioning between here and there, we are not holding up our end, but we are on the right path. Thank you so much for what you do, and for the staff of the Ministry of Health, for everybody who work in the health sector. I recognize you and I appreciate your sacrifices. Thank you so much, and be blessed. And if I may excuse myself, because I need to be somewhere else to present, I would highly appreciate that. Thank you.